Good afternoon. My name is James Williams, and I'm the County Counsel for the County of Santa Clara. Thank you for joining us for an important update and announcement today with respect to COVID-19. Joining me this afternoon are a number, over 20, healthcare professionals and paramedics who are dealing with the front lines of the increase in hospitalizations here in Santa Clara County. And speaking this afternoon with some important announcements and updates, joining me will be Dr. Sarah Cody, our County Public Health Officer, Dr. Clifford Wang, Chair of the Department of Medicine at Valley Medical Center, Elizabeth Bruley, RN, the Emergency Department Manager at O'Connor Hospital, and available for questions will be Dr. Jeff Smith, the County Executive, and Dr. Ahmad Kamal, the Head of the Emergency Operations Center Healthcare Surge Branch. I'm going to begin by turning it over to Dr. Cody, who's going to talk about where we currently are with respect to cases and hospitalizations, and then I will come back and talk more about some of the updates that we're making today.
Thank you, James. Good afternoon, everyone, and thank you so much for joining us. Today, I have some sobering news to share, and I know that this news is not what any of us would like to hear, nor is this situation one that any of us would like to be in. But nevertheless, here we are. And I also know that many people living in our county have been making extraordinary sacrifices over the last many months, since February. And now we are asking everyone to do more, even more. The decisions that we are making today are extraordinarily difficult ones, far more difficult than they were when we made similar decisions in March. However, we have come to a place where our cases and our hospitalizations are so high that we must do something to settle things down. I have been sounding the alarm about our rising case rates and hospitalizations for some time, and we are now at a critical inflection point. In fact, what we do or what we don't do starting today may mean a matter of life and death for many living in our county. So our case rates and our hospitalizations continue to surge. We have a few graphs here to show you. I'm going to tell you what I see, and I want to show you what I see. I want the public and all of you to know and to see what we know and what we see, and why we're making the decisions that we're making. This is our epidemic curve that you've seen many times, and you can see that over there on the far part of the curve in November, our case rates have been surging since the beginning of November. In fact, we now have the highest case rate of any county in the San Francisco Bay Area. Just today, we had 760 new cases, far shattering any previous record by over 200 cases. Those cases were from people who had their specimens collected, 95% of them over the last 5 days, so these are recent cases. In addition, and our next slide, our next graphic, These are hospitalizations. All of our hospitals combined, these are the number of people with COVID in hospital beds over time. And you can again see the very sharp rise that's been occurring in November. Today, the number of people with COVID in hospitals across our county is 239. That is also a record. We have never had that many people with COVID requiring hospitalization ever in the pandemic to date. People hospitalized with COVID, that number has more than doubled since November 12th, as you can see there. We had just 110 on November 12th, and we now have 239. And most concerning, many of our hospitals, we can go to the next one, have very little remaining capacity in their ICUs. And this is particularly in hospitals serving communities that have been most heavily impacted by COVID. This pandemic is like a high-speed train, and our projections tell us that we are on target to derail by around the third week of December if we don't apply brakes right now with all our collective might. To further complicate our situation, we also have many added challenges at this point in the pandemic. These projections that we have, they don't account for the fact that our hospitals typically fill with patients this time of year, whether it be from cold and flu or for other reasons. So there's even less capacity to absorb a surge in COVID patients. These projections that we have also don't take into account Thanksgiving, where many people did gather and many people did travel, and we anticipate that this is going to create a surge, also not accounted for in our current projections. In addition, whereas in the past, in the spring and in the summer, when we were surging, we would always know that there would be healthcare workers, travelers from other parts of the country that could come in and help if we needed. And right now, as you know, every part of the country is experiencing a COVID surge as we are. And so we must plan to ensure that we are able to take care of ourselves with the healthcare workers currently in our hospitals. So this is our hospitalizations are a significant concern, and they are the primary driver for the decisions that we are making. We want to ensure, as always, that everyone who needs care, be it because they are ill with COVID or have a heart attack or stroke or a trauma victim or simply need to deliver a child, that they have access to the best health care available with trained staff to care for them. And so today we are between an extreme rock and a hard place. Of course, we will be continuing our focused measures to control COVID, our testing, our contact tracing, our outbreak investigations, isolation, quarantine, education, public communication, enforcement. All of those things we will continue to do. Yet we must do more. We must take broader measures, because our focused measures, as we've seen, are no match for the tsunami of cases and hospitalizations that are coming. So we will continue to go all in, and we are asking everyone in the community to stand with us and to do the same. So today we are announcing a tightening of our directives, and James will discuss these details. This is not a shelter-in-place order as I issued in March, but nevertheless, the broader message is simple, and that is that we urge everyone to stay home to the greatest extent that you can. Please stay home. Do not go out unless it is for essential reasons or essential purposes. We are in the midst of this severe surge. I want you to know that we do not ask people to take these measures lightly. We do not put these restrictions on businesses lightly. These are extraordinarily, extraordinarily painful and difficult decisions, but it is a matter of life and death, and we must slow this train or it will derail. But I am confident that together we can do this, we can beat it back, we have done it before, and we will do it again. Thank you so much, and I'm going to turn it over to James to provide further detail.
As Dr. Cody noted, we are making a number of changes in the existing directives that we have in place to help try to bring down the increase in cases and hospitalizations here in Santa Clara County. I'm going to walk through what some of those key changes are, and of course they'll be available on our website. We have an executive summary that we're putting out. These changes will go into effect on Monday and will remain in place until at least December 21st. First and most significantly, we are across the board reducing the capacity in indoor facilities that are open to the public. Specifically, stores and all other facilities open to the public will be limited to a 10% capacity indoors. Grocery stores, drugstores, and pharmacies, however, will be allowed to operate at 25% capacity indoors. And that's to ensure sufficient access to food and medicine. In addition, to help make these capacity limitations real, all facilities open to the public must establish a metering system to ensure that the applicable capacity limits are not exceeded. So, for example, they can achieve that by posting somebody at the entrance to count those entering or exiting. Again, these capacity limits will be applying across the board to indoor facilities open to the public. For outdoor gatherings, we'll continue to allow outdoor gatherings, and the state allows them for First Amendment purposes, such as religious services or protests, even in the purple tier. However, the maximum will be reduced to 100 people. For professional, collegiate, and youth sports, all recreational activities that involve physical contact or close proximity with persons outside of one's household, including all contact sports, will be temporarily prohibited. People can continue to engage in other outdoor athletic or recreational activities that don't involve direct contact or close proximity. Card rooms, both indoors and outdoors, will be temporarily closed. Hotels and other lodging facilities will be only open for essential travel or for use to facilitate isolation and quarantine. And we're issuing a new mandatory directive related to travel that discourages any leisure or non-essential travel and requires a quarantine for 14 days upon return to the county if you have traveled from more than 150 miles away. Healthcare workers who are traveling into the county to provide care to patients or those traveling into the county to obtain treatment are exempt from this requirement. Our hope is that these measures, layered on top of the measures that the state has taken with the purple tier closures and the additional measure that the state has taken for the 10 p.m. to 5 a.m. limitation on only allowing essential businesses and activities to be open. Our hope is that these additional measures will bring down the rate of growth such that our hospitals will not be overwhelmed. I want to re-emphasize some of the numbers that Dr. Cody already mentioned. 760 new cases today. It's a new record. 215 more cases than our last record from just a few days ago. 239 hospitalizations, including 59 new hospitalizations yesterday, 71 of whom in our ICUs. Again, record number of hospitalizations. These are not records that we want to have here in Santa Clara County. And together, we believe that if we strictly adhere to these safety protocols, we can once again rein in this surge, ensure that access to health care is available, and help keep our community safe and avoid countless serious illnesses and death. We'll now turn it over to Dr. Clifford Wang, Chair of the Department of Medicine at Valley Medical Center.
Well, good afternoon. I just came from the COVID unit, and we are all feeling and seeing the impact of COVID-19 in our ICUs and our medical surgical units. Our staff, physicians and nurses and other staff are working round the clock, doing extra shifts to care for all the patients. It's a stressful time, but we know that we're heading into probably one of the most toughest periods of the pandemic because we're getting hit both with COVID and non-COVID cases. This is one of the busiest times of the year. It's a time when we're just starting to see the flu early on, but we haven't even seen its apex yet. We have to be open to other patients that have other conditions, heart attacks, strokes, accidents. We really need to protect the healthcare system from being overwhelmed and overburdened, overcrowded. It's the lifeline of our community. So we really need your help to really decrease the spread of this condition, COVID-19, so that we can keep our doors open to all patients during this time. Please wear a mask, physically distance, avoid large gatherings, and try to stay at home as much as you can. We really appreciate your help. We're counting on the whole community. Please help us during this time. Thank you. Elizabeth is going to share with you as well from O'Connor Hospital.
Good afternoon. My name is Elizabeth Bruley, and I am the manager of the emergency department at O'Connor Hospital. Like other hospitals in this county, we have seen a concerning increase in the number of patients admitted with COVID into our hospitals. We need to be sure that our hospitals have enough space and staff to take care of these patients. Those with COVID, as well as patients with other illnesses. It is important for us to take measures to decrease the community spread of COVID to ensure that our hospitals can be there to take care of everyone. Thank you very much for your support.
We will now open up for the question and answer portion of it. Please let us know if you have a question. We'll call on you. We'll start with the Silicon Valley Business Journal.
Question for Dr. Cody. Would you clarify explicitly what you meant by the metaphor you used early on when you said about the third week of December, cases could derail? Are you talking about hospitals reaching capacity to handle COVID? What exactly are you saying?
To clarify, the current trends that we have, both the rise in cases and the resulting hospitalizations, we work with a number of academic partners to do projections to anticipate how many hospital beds we will need to care for COVID and other patients. Those projections are all converging and tell us that around the third week of December, at our current trends, we are likely to run out, meaning that when those running out of our regular beds, and after that, we would have to go into surge beds, which is a different way of staffing and operating than the regular beds that we have across our hospitals.
Just a follow-up on that. At that point, are you talking about a situation where doctors have to make decisions? Some people can be treated and some can't, or are you talking about moving into some expanded mode?
That's when we move into surge, and actually Dr. Ahmad Kamal is in the best position to talk about what that means if you have further questions.
Next we'll go with KGO TV.
Yeah, so what's the impact for professional sports, teams like the 49ers, the good travel, in and out?
Yeah, I'm gonna leave those questions because it's particularly applying our directive to those situations, and I'm gonna turn it over to James Williams.
What is the capacity of the beds right now?
So for beds, I'm gonna direct you to Dr. Kamal. So maybe we'll bring up Dr. Kamal and run through those questions.
So we've been working with our hospitals since the beginning of this pandemic to come up with plans as to what to do in such a scenario. Hospitals have developed surge plans to deal with an influx of patients. However, we have to understand that these surge plans depend on adequate staffing. At the current time, given the state of the pandemic throughout the country, staffing shortages are very real. So we have to be cognizant of the fact that the hospitals cannot do this by themselves. We as a community must take steps to prevent the transmission of COVID so that hospitals are able to keep up. In answer to your questions, we are hoping to never get to the point where doctors need to make the very difficult decisions you alluded to. That is why we are taking the steps today that we need to do.
Next question for KPIX, please.
What is the impact for professional sports?
So the update today to the Professional Sports and Collegiate Sports Directive will temporarily suspend activities that require direct physical contact or interaction in Santa Clara County. So that means that for those teams, they will not be able to play games or have practices where they have direct contact within the county.
Is that including the 49ers?
Yes.
Have you contacted the team?
We have been in touch with and will continue to be in touch with all of the affected parties, including sports teams.
And what did they say?
I'm not going to comment on what other entities
If we can
say.
move and let other people have a chance to have questions, move on to KPIX next, please.
James is here on the focus there. Can you tell me about any effects on outdoor dining as it is right now, or actually restrictions?
Sure. So the question's about outdoor dining. Outdoor dining will remain open. We have some very stringent rules in place with respect to outdoor dining, including spacing between tables and many other requirements. As you probably know, we continue to be in a pretty significant effort with respect to compliance, and those efforts will continue not just this weekend but going forward. And we believe that if there is appropriate, strict adherence to those protocols, the outdoor dining at this time can continue.
Clarifying a couple more things. You say park rooms, indoors, and outdoors closed. But then K101 and Matrix, those are basically closed at this point then?
Yes, that is correct.
And then also you talked about requiring travelers to quarantine for 14 days. Those are the folks who are coming in, whether they're residents here or not?
Yes.
So how do you enforce that?
Sure.
Joe Smith just came back.
Thank you for that question, because that is, I think, one of the most significant new pieces. It's a new directive related to travel. Any persons entering into Santa Clara County, whether they are residents who traveled and have now returned, or others who are coming in to visit, will need to quarantine for 14 days if they've come from a point of origin more than 150 miles from the county. And the intent behind that is we recognize that there are people from adjacent locales who live and work across county lines. The requirements will have to be provided to travelers upon arrival. So we're requiring transit facilities where people may be coming from greater than 150 miles. So for example, the airport or train stations, to affirmatively provide the quarantine information to those travelers so that they know upon arrival, and to also provide notices to publicize that requirement. There are other states that have put in place various forms of quarantine measures. We are very concerned about, of course, the situation more broadly across the United States and elsewhere in California. And we have been repeatedly discouraging travel. I think you've heard that now several times at several previous press conferences. But this is another step to try to keep the community safe when folks are engaging in travel.
Sorry, the last clarification, what could enforce that? I understand you guys have got the information at train stations, bus stations, airports, but how do you guys follow up and enforce to make sure these folks actually are
Well, one piece of it is the change also to the directives related to hotels and similar lodging facilities, where they can only be used for either the purposes of, for essential purposes or for isolation and quarantines. That's a piece of it. But, it's part of our overall enforcement efforts. We have actually had most people in this community take these measures very seriously, and I think people will recognize what a pivotal and critical time we are in right now.
Yeah, despite all these changes that you've announced, am I clear that there's been no change to the tier status?
Correct. So the question was about the tier status, which is from the state. The state has this 4-tier system: purple, red, orange, yellow. We remain in the purple tier under the state framework, and so all of the state's purple tier restrictions remain in effect here locally. So for example, under the purple tier, the state prohibits indoor dining. Under the purple tier, the state prohibits a number of other indoor activities, such as indoor family entertainment centers. All those state prohibitions remain in place. This is an additional protective layer on top of that state framework.
And you've gone through the case numbers and the hospitalizations. Can you update us on death count?
If I recall the number correctly, I believe we are at 476 deaths. And unfortunately, we know that number will rise in the coming days, given the number of patients in the hospital and given the rising case counts. Deaths lag the rise in cases, and they lag the rise in hospitalizations. So that's something we're extremely concerned about. We don't want to see more death in our community as a result of COVID.
Count two.
You mentioned the spike in the most recent spike in the past that you guys have seen. Is that just a full early that's going to come back when everybody starts to come back to this area and potentially travel again?
So the question is, this spike in cases, the 760 cases that we have today, what does that mean with Thanksgiving and travel and gatherings related to Thanksgiving? These are, of course, cases where the specimen was collected before Thanksgiving, and so it doesn't reflect what may be happening or may have happened in the last few days. And we are extremely concerned, as Dr. Cody mentioned, that we are going to see those numbers climb even further. This virus, like many, grows exponentially if unchecked, and that exponential growth is what has us most concerned.
So you got educated ready to prepare to receive the vaccine. It is coming, what the federal government said.
I'm sorry, I missed the question.
Is the county ready to receive the vaccine as the federal government?
So the question is whether we're ready to receive the vaccine. We have a whole team in the Emergency Operations Center that's focused on logistics issues related to the vaccine, so that we are absolutely in a position when it arrives in the county to be able to distribute it and to work with healthcare providers to ensure that distribution. There are a lot of different vaccines out there and several that are in the final stages. They all have different characteristics, and we're aware of that and taking that into account in all of our logistical planning.
KPX?
Yes, I know you guys have said in the past that pandemics are bad for health policy and what's bad for business and the other both aspects. For the business owners, we're seeing that hey, the holiday season, this is what we need. Basically, to make enough money to go through the next several months.
So the question is about businesses and the impact of these capacity reductions, especially during the holiday shopping season. You know, I think there's three things that I would share. First of all, this is extraordinarily difficult. I think Dr. Cody mentioned these are not easy decisions, and no one wants to be in this position. But the health of our economy and the health of our community actually go hand in hand. It's not so much a balancing. When we have a virus running unchecked in our community, that itself contributes to economic hardship in our community. Serious illness and death also contributes to economic hardship in addition to the extraordinary human suffering. And these things are fundamentally interrelated. They're inextricably intertwined. We want to be in a position where absolutely businesses can be open at full capacity. And we're taking these measures to at least allow the 10% capacity with metering so that as much as possible, folks can still go in. They're not closed completely like a full shelter in place would be. But there's no doubt it's extraordinarily challenging for the entire community. It's extraordinarily challenging for our healthcare providers, absolutely for affected families, and emphatically as well for business owners and for workers. This is an unprecedented pandemic, and no life in this county is untouched. So the question is, if you are merely transiting through Santa Clara County, are you subject to the 14-day quarantine? And the answer is no. If you are actually in transit through to some other destination, it would not apply. But if you are coming here to stay here, it would.
Anything else? Any last question?
Thank you.
Capacity of the beds? Yeah. The capacity of the beds, currently at all hospitals.
I don't have that number off the top of my head.
As of yesterday, there were approximately 70 ICU beds reported unoccupied in hospitals. We have to keep in mind that on top of that, many hospitals have 5 or fewer beds. This means that their ability to take care of additional patients, whether they be for COVID or other critical health conditions, is quite limited. We are very concerned particularly about that, which is one reason for the steps today.
Just a quick question. Are eye doctors, dentists, all that's open? Will too? It's part of the health.
Yeah, all healthcare operations remain open, and they remain open under both the state framework and locally, just as they did during shelter in place.
We'd like to thank everyone for coming. We'll be available for questions in other languages afterwards. And thank you for attending and helping us spread the word about all the information today.
Grocery stores, drugstores, essential business, basically essential.
It's actually much narrower than our old definition of essential. The old definition of essential would include hardware stores, auto repair. It's just grocery, pharmacy, drugstores.
Maribel Martínez, oficial de Información Pública sobre COVID-19, Condado de Santa Clara. El resumen ejecutivo de las revisiones a la Directiva Obligatoria de Funcionario de Salud emitidas el 28 de noviembre 2020. El número de residentes del Condado de Santa Clara que contraen COVID-19 y el número de pacientes hospitalizados con COVID-19 ha seguido aumentando durante las últimas semanas. Si estas tendencias continúan, los hospitales del condado alcanzarán o superarán su capacidad en las próximas semanas. En la actualidad, varios hospitales del condado, particularmente en el este y sur del condado, tienen pocas o ninguna cama disponible en cuidado intensivo. Para reducir la probabilidad de un aumento de hospitalizaciones que excederían la capacidad de los hospitales en el condado, la oficial de salud está haciendo varias modificaciones a las directivas obligatorias actuales aplicables a las empresas y los residentes del condado, incluida la obligación de ciertos sectores modifiquen sus operaciones para aumentar la seguridad, reduciendo el número de personas permitidas en instalaciones a cualquier momento y reduciendo el tamaño de las reuniones al aire libre. Además, se prohíben ciertas actividades de mayor riesgo. La oficial de salud también emitió una directiva obligatoria sobre viajes, que desalienta fuertemente los viajes de gusto o no esenciales y requiere que las personas que ingresan al condado se mantengan en cuarentena 14 días al regresar de un viaje de más de 150 millas. Esas directivas obligatorias revisadas y nuevas entrarán en vigencia el lunes 30 de noviembre 2020 a las 12:01 a.m. y permanecerán vigentes hasta el 21 de diciembre 2020 a las 5 a.m., a menos que se extiendan. A continuación, son los cambios claves que se están realizando en las directivas obligatorias. Límites de capacidad para instalaciones interiores abiertas al público. Las tiendas y otras instalaciones abiertas al público se limitarán a un 10% de capacidad interiores. Sin embargo, las tiendas de comida, comestibles y farmacias podrán operar al 25% de capacidad al interior. Toda instalación abierta al público debe establecer un sistema de medición para garantizar que los límites de capacidad aplican. Reuniones al aire libre. Las reuniones se siguen permitiendo solo al aire libre con un máximo de 100 personas. El Estado limita tales reuniones a actividades protegidas por la primera enmienda, como servicios religiosos o protestas, deportes profesionales, universitarios y juveniles. Se prohíben temporalmente todas las actividades recreativas que impliquen contacto físico o proximidad con personas ajenas al hogar, incluyendo todos los deportes de contacto. Las personas pueden seguir participando en actividades deportivas y recreativas al aire libre, tanto donde el distanciamiento social se pueda mantener en todo momento. Salas de cartas. Las salas de cartas están cerradas temporalmente. Hoteles y otras instalaciones de alojamiento. Los hoteles y otras instalaciones de alojamiento estarán abiertas solo para viajes esenciales y para facilitar el aislamiento y cuarentena. Después del viaje en cuarentena, los viajes de gusto y no esenciales son fuertemente desaconsejados y una nueva directiva obligatoria sobre viajes requerirá que las personas se pongan en cuarentena durante 14 días al regresar al condado de un viaje de más de 150 millas. Los trabajadores de salud que viajan al condado para brindar atención a los pacientes o pacientes que viajan al condado para recibir tratamiento están exentos de este requisito. Gracias.
大家好，我是圣塔克拉拉县紧急行动中心的 Ann。今天，卫生局长对现行的强制性指令再一次做出修订，包括要求企业更改营业的方式，减少一次可以进入设施的人数，降低户外聚会的规模，还会禁止某些较高风险的活动。因为新冠确诊和住院的人数持续的增加，确诊人数到今天为止已经超过了700例。在未来几周圣县的医院呢，将会达到或者是超过负荷。如同卫生局长 Dr. Cody 所说，新冠疫情像是失控的火车，我们必须 要赶紧刹车。目前在东区和南区的几家医院几乎已经没有重症监护病床，我们必须要确保我们有足够的医疗系统来治疗一般的病患。以下是部分强制性指令的变更：对于可容人数的限制，商店还有一般设施的室内可容人数不得超过10%，但是杂货店、超市、药局可以到达25%。对于户外的聚会，允许宗教还有抗议的活动，在户外进行，但是允许的人数将从200人降低到100人。饭店还有其他住宿的设施呢，只能对必要的旅行开放，或者是作为检疫或是隔离。对于旅行的强制性指令，强烈不建议任何的休闲或者是非必要的出行。新的强制性指令要求人们从150英里以外的地方回来，圣塔克拉拉县的话，自行做检疫14天。这些修订还有新的强制性指令，将于星期一11月30日凌晨12点01分生效，将一直有效到12月21号凌晨的5点，除非另行延长。想要了解更多的详情，请参阅www.scc.gov.org/COVID-19。我们恳请大家跟我们一起抗疫，勤洗手、戴口罩，严格遵守社交的距离，千万不要大意，尽可能的待在家里面。最后，祝大家平安健康，谢谢。
Xin chào quý vị, tôi là Khánh Ly, là nhân viên truyền thông của quận hạt Santa Clara. Thì ngày hôm nay, quận hạt Santa Clara đã có một buổi họp báo để các viên chức cơ sở y tế có thể đưa đến cho quý vị những cái khuyến cáo, những cái lời cảnh tỉnh. Bởi vì chúng tôi nhận thấy rằng có một sự tăng mạnh giữa các con số nhiễm Covid-19 và con số nhập viện trong mấy tuần vừa qua. Kính thưa quý vị, số ca nhiễm Covid-19 và nhập viện tại quận hạt Santa Clara đã tiếp tục tăng mạnh, đạt ở mức kỷ lục. Có nghĩa là đây là một cái mức kỷ lục mới tính đến thời điểm hiện tại từ trước tới giờ, kể cái ngày mà mình biết được là có Covid nó hiện hữu trong cái quận hạt của mình cho đến nay. Thì theo dữ liệu thống kê có được ngày hôm nay thì chúng ta có 760 ca nhiễm Covid-19 mới và 239 số người nhập viện, thì trong đó có 71 người là phải nằm trong phòng chăm sóc đặc biệt, có nghĩa là những người này là rất là nặng, cần phải có được một cái sự chăm sóc đặc biệt để họ mới có thể khôi phục được, và mình không biết được là họ có những cái trạng thái nghiêm trọng về sau hay không. Thêm vào đó thì chúng tôi tổng kết được là có 476 số người tử vong cho đến thời điểm hiện tại. Chúng tôi rất là lo lắng bởi vì mình chỉ mới đang tiếp nhận những cái trường hợp Covid-19 thôi, và mình vẫn chưa tính đến những cái trường hợp mà có nhiều thêm thiên tai nữa xảy ra và nhiều cái tai nạn nữa xảy ra, thì những cái giường bệnh đâu mà mình có thể phục vụ được những cái người này thì mình không biết được. Đó là lý do tại sao mà để làm giảm cái số ca nhập viện tăng mạnh vượt quá khả năng tiếp nhận bệnh viện trong quận hạt, thì Giám đốc Sở Y tế đã đưa ra một số các sửa đổi để dành cho những cái chỉ thị bắt buộc cho một số ngành đi cùng với lệnh giảm thiểu rủi ro của Sở Y tế. Thì những thay đổi bao gồm là chúng tôi sẽ giới hạn sức chứa cho các cơ sở kinh doanh đang được mở cửa ở trong nhà, có nghĩa là các cửa hàng và các cơ sở kinh doanh đang hoạt động ở trong nhà sẽ giới hạn ở mức là 10% sức chứa. Tuy nhiên thì các cửa hàng tạp hóa và các tiệm thuốc sẽ được hoạt động ở mức 25%, bởi vì chúng tôi muốn rằng cộng đồng vẫn có thể tiếp cận được những thực phẩm và những cái thuốc để chữa bệnh, thì quý vị vẫn có thể tiếp cận được. Thứ hai là tụ tập ngoài trời. Chúng tôi giảm cái số lượng người tụ tập ngoài trời xuống còn 100 người, lúc trước là 200 người. Và điều này sẽ được áp dụng cho các dịch vụ về tôn giáo và các cuộc biểu tình. Thì nếu như mà quý vị là những cái cơ sở nằm trong cái cuộc tụ tập mà được hoạt động ngoài trời thì quý vị phải tuân theo những cái quy định mới này được đề ra. Các hoạt động thể thao chuyên nghiệp cho trường học và thanh thiếu niên, ví dụ như là các cuộc thể thao mà có yêu cầu cái sự tiếp xúc về cơ thể và tiếp xúc gần gũi giữa những cái người mà không sống cùng nhà, thì quý vị cũng phải không được tiếp tục xảy ra. Thì cái hoạt động này thì tạm thời được nghiêm cấm. Sòng bài sẽ bị tạm thời đóng cửa. Khách sạn và các cơ sở lưu trú sẽ được chỉ mở cửa cho các chuyến đi xa cần thiết và chỉ được sử dụng như một nơi để cách ly và cô lập mà thôi. Thêm vào đó thì chúng tôi cũng đưa ra một cái chỉ thị bắt buộc dành cho việc đi xa, đi công tác hoặc là dành cho việc du lịch. Thì chúng tôi không khuyến khích các cuộc du lịch giải trí và các chuyến đi xa không cần thiết. Thì những cái chuyến đi này là không nên được thực hiện tại thời điểm này. Và chỉ thị bắt buộc mới dành cho du lịch và đi xa sẽ yêu cầu những ai mà tham gia những hoạt động này là phải cách ly trong vòng 14 ngày. Thì cái đây bây giờ đã thành một cái lệnh và một chỉ thị bắt buộc, thành ra là quý vị nếu như quý vị đi xa khỏi quận Hạt, ra khỏi 150 dặm ra khỏi quận Hạt thì quý vị phải cách ly 14 ngày để có thể mình theo dõi những cái triệu chứng của mình sau khi mà mình trở về. Các nhân viên, tuy nhiên thì các nhân viên y tế đi vào quận Hạt để hỗ trợ chăm sóc sức khỏe, hoặc là những cái bệnh nhân mà đi vào quận Hạt để được chăm sóc sức khỏe hoặc là đi khám bệnh thì quý vị được miễn cái yêu cầu này. Kính thưa quý vị, thì các chỉ thị mới vừa được thay đổi và vừa mới được cập nhật sẽ có hiệu lực vào lúc 12 giờ sáng thứ Hai ngày 30 tháng 11 năm 2020 và sẽ tiếp tục có hiệu lực đến 5 giờ sáng ngày 21 tháng 12 năm 2020. Và chúng tôi sẽ có sửa đổi nếu như tình hình Covid-19 tại thời điểm đó nếu tăng quá mạnh hoặc là nó nghiêm trọng hơn thì chúng tôi sẽ có những cái sửa đổi nhất định và chúng tôi sẽ thông báo đến cho quý vị sớm nhất có thể. Nếu như mà quý vị muốn biết thêm thông tin chi tiết về những cái lệnh mới này được đề ra thì quý vị hãy đi vào trang mạng của Sở Y tế Công cộng. Chúng tôi có trang mạng được dịch thuật hoàn toàn bằng tiếng Việt là www.scc.gov.org/CV19-Việt. Chúng tôi sẽ làm việc cực lực trong tuần này để có thể đưa đến cho quý vị những cái thông tin cụ thể nhất. Xin chào quý vị. Xin cảm ơn.